It was within a week of her being born, she started to get some irregular blood tests. And she was jaundiced, she was very small. The attending doc knew to order another set of tests. All of those tests came back and showed that she likely had this very rare syndrome called Alagille syndrome. When they made that diagnosis, he referred us to a specialist at Children's.
That's when Dr. Sokol came into the picture, and it's been a great relationship ever since.
I think all of us are first a pediatrician, secondly a gastroenterologist or hepatologist or surgeon. And we realize that the experience of the child is really very important. They're the ones who have to live with this disease, and if we have a close relationship with them, everything goes better.
There were a lot of things that started happening right away. Nutrition, making sure she got enough calories, monitoring her cholesterol.
You know, on the one hand, you can transplant, which is a pretty heavy-duty thing to take on. The other thing that you can do is to experiment with medications, and it mattered also to have a doctor who was so knowledgeable about this and who could communicate it.
Our goal is always to avoid a liver transplant if we can, and put together a medical therapy regimen that allows the child to grow and develop as normally as possible. And if the child gets to the stage where they need a liver transplant, we have an outstanding liver transplant multidisciplinary team.
Having the contact with Dr. Sokol and his entire team was such a huge comfort. People heard us and they listened to us when we explained our issues and what we dealt with every day. They took time and to actually talk to Signe, and to us too, of course, but to create a relationship with her, which I think was really important for her, to feel that connection.
It's important for families with a rare disease to be seen at a center that takes care of children with rare diseases, but also that participates in a national or international consortium. And the reason is there's so many unanswered questions in terms of what causes the diseases, being able to do clinical trials and clinical research to develop new therapies, and finally understanding long-term outcomes and the best approach to taking care of the child.
We are right now benefiting from clinical trials that have been done in the past. Also, Dr. Sokol has been quite shrewd in identifying trials that have some potential to be beneficial to her, to give us information. The trials that we've participated in, they've all been presented to us with some consideration for the needs that Signe has right now, too.
Signe is going on 10. She'll be 10 in July. And she's the most energetic, stubborn, but really, really sweet kid. Lots of empathy and an artistic soul.
Signe really has her symptoms of Alagille syndrome very well controlled. She's growing, she's developing, she's in school, she's absolutely adorable.
She's in a pretty good place. She lives a pretty normal life, other than having to deal with medications and doctor's visits on a regular basis. And my hope for her is that we can give her the best quality of life that is possible.